Okay.
Good morning. I'm Dr. Janie Heath, Dean of the College of Nursing at the University of Kentucky, and welcome to our Armchair Nursing Leadership Series, where today we are thrilled to have Dr. Cary with us. Dr. Cary is the Dean of the University of Missouri-Kansas City School of Nursing and Health Studies, and the upcoming President/Chair of the American Association of Colleges of Nursing. So let's jump into the journey for how you have made this all possible. How did you know you first wanted to be a nurse? If you don't mind sharing that story.
Well, it's interesting because as I was thinking about that question, I was reflecting back on the picture that I still recall when I was 3 years old, and I was dressed in my mother's nursing uniform and cap.
Oh my.
And I was taking care of my father, who was laying on the floor, and he was pretending to be a patient.
Oh.
And so I had a thermometer in my hand.
Oh.
You know, the old
Yeah, the glass
thermometer.
ones.
Yeah, the glass ones.
Yeah.
And so I still have to laugh every time I see that picture because that was imprinted on my brain. So my mother was a fabulous woman, a nurse, and I think she really helped me see that nursing was a career that I could resonate with.
Oh.
Yes.
Okay, when did you first know that you wanted to be an academic leader as a nurse?
Well, I would say it first started with wanting to be a faculty member. So I remember sitting in the classroom and observing how the faculty taught and what resonated with me as a learner and thinking, gee, I'd like to do that someday. You know, to be able to influence the lives of young students through being a faculty member was very stimulating for me. So I decided very early on, as soon as I graduated, I applied for a master's program. And I didn't get accepted the first, well, I was accepted, but I wasn't funded by the nurse traineeship the first year. And I really needed to work. So I worked for a year and then I was funded.
Oh.
So I was able to go right into my master's in public health the second year I was out of school. And it was there that I took nursing education courses and was really, didn't really appreciate how difficult it was to be a faculty member. In terms of, you know, all the prep work, etc. And then when I became a faculty member, I started observing administration, how programs were run, how policy supported or became structural barriers to getting the work done. And then I thought, okay, this is something I think I want to do too, you know, because you can influence people in a larger sphere.
Yes.
So when I decided to go back for my doctorate about 8 years later, I decided that I wanted to go back and really learn that skill set that would help me be an administrator.
Okay, next question. What academic nursing career advice would you give to aspiring leaders? If maybe you could give 2 or 3 tips that you have found that's helped you be successful that others might learn from.
Well, I think my greatest learning has come from really processing any barriers or failures that I've had and watching how others handle theirs. Because I believe that in order to succeed, you have to actually fail.
Yes, yes.
So you do it, you fail, you do it, you fail.
Yes.
And that people watch out for you and guide you through that process. So that was something that was very important to me. Having people give me feedback, show me a way in which I could be effective, and then really nurturing that when they saw it. So I guess that would be some mentorship.
Good.
You know, seeking a good mentor. And then I would say process what you think is not effective as a leader. And how would you do things differently? So learning from how others are failing and trying to avoid making some of those missteps as you move through would be another characteristic I would think would be important. At least it was for me. And then also not being afraid to risk. So I actually stepped out of academia for 3 years and worked for a research institute. And I learned a whole new skill set there. And then I found out what I liked about that and what I didn't like, and then ended up back in academia. But I took that whole skill set with me. And so again, you know, widen your perspective, do things differently. don't be a straight line, be a squiggle.
Right, yeah.
Because it's going off the beaten path that really enriches your repertoire of skill set.
Yeah, that's great. I wish I had gotten that advice a long time ago.
Please.
Okay, building off of those tips, and what keeps you awake at night? In particular, as a dean, what do you worry about? What keeps you awake at night?
Well, that's a very good question because I'm awake most nights. So the kinds of things that wake me up are concerns about whether or not I'm gathering all the resources I need so that the faculty can do what they need to do. And as you know, we're in a period of budget compression in most of our schools across the country. So this is not unique to where I work. In fact, everywhere I've worked, there's been some cycle of budget compression. So gathering the resources are really important. That's my job, to make sure that my faculty and our students have what they need to have a positive and an experience of excellence.
Right.
So that's one thing. Another area is the ways in which we are inclusive for our students, because the world has changed, as you know, and there is such a diversity that is accessing higher education now. And so how are we able to be accommodating? How can we learn from that diversity of our students and our faculty? And how will we change the way that we teach and develop the leaders of the future? So that's something that I'm constantly thinking about. And luckily I have really good support services at the university to do that. So that I think is important.
Yeah,
Know what your resources are.
Right.
And then finally, I would say that I'm concerned about the voice of nursing. We are all, leaders in nursing are very good about coming to the table and sharing their voice. And I want to make sure that we are developing the leaders behind us who will have that same commitment to risk-taking in their voice, to making sure that the American people get the best in health care. And I think nursing is part of that solution.
That's inspiring. That it is. It really is, and we need more of that. We really do. So flipping it a little bit, if those types of things keep you awake at night, what fills your heart, Ann? You know, what do you get most excited about as being a dean of nursing?
Well, one of the things I love to do is I address all the incoming students, and I do it class by class.
Okay.
And I love to I'll walk in the room and they're buzzing and they're all excited, etc. And then I love to tell them that they will be the first and the last. So they will be the first one, for instance, to welcome a newborn baby. The first one to create perhaps a new app for communication or for a patient. And they'll be the last one to hold the hand of someone who's dying. And the room gets quiet.
Yeah.
It's like they're really seized with the thought of their impact.
Yes.
And I just love it.
Yeah.
Because it's really sharing my passion for patient care with the next generation of nurses. So that's something I just love to do every year when I meet with the students.
Oh, that's so good.
And I love to meet with the faculty as well. I like to meet with faculty in small groups because if they ping off one another and you have a synergy that happens in that dynamic. And I learn so much from them about them and what they need by using those small groups with faculty. So I enjoy doing that as well. And then finally, I really love to bring information from the national and the global scene back to the faculty and show them what are the opportunities and the aspirations that they can be thinking about and how can I help move them in that direction.
So you're getting ready to, take on, our leading organization for higher education in nursing, the American Association of Colleges of Nursing, that just does phenomenal work and really provides tremendous support for the colleges of nursing throughout the country. What do you see as next steps? Where do you see our organization going? What vision do you see that we're going to be leading into when you take over just in a few months?
Well, first of all, I would say that, I'm standing on the shoulders of giants, because the leadership in AACN has been phenomenal. And so just to step into that space and to make sure that I honor the trajectory of those leaders and the organization is something I'm very committed to. So this is not about me, but this is about our members. And I just love listening to our members. I learn something new every day when I do that. So the way the organization is proceeding at this point, we do have a strategic plan. And one of the pivotal aspects of that strategic plan is looking at our governance structure based on the Futures Task Force.
Yes.
So what I would see happening is, depending on the will of the members, the vision of the members, and what they would like to see the organization develop into, I would see perhaps our governance structure changing, being more inclusive than it is.
Oh, good.
Being
You mean opening up with the membership? Or?
Right. Looking at different, well, I'm going to say membership, but different communities of interest
Okay.
to join us in AACN. Looking at the opportunity for our interprofessional partners to be influential, or at least provide information to us in a way that we haven't done before. Because, interprofessional professionalism is really the dynamic of the future. And AACN has taken a lead in that with our other partners through our past presidents' decisions. So I think the governance has the likelihood of encouraging more inclusivity than we've had in the past. And that's not to say that that's been a deficit. But I think as the world changes, we need to change too. So that will be one thing. I think our policy voice will strengthen even more so because of that governance. We will develop stronger coalitions than we have in the past. We have strong coalitions within the nursing organizations, but again, it's that broader framework of coalition building that's going to take us to the next level. And then finally, I think that AACN can be dramatically influential in the research agenda. So again, linking that with the policy coalition development work, with forging the new sciences, both in nursing and in healthcare, are really going to be an impact that AACN can make in the future.
I'm ready. I'm excited.
Well,
That's
join
great.
us, of
That's
course.
great. That's great. Well, let's just flip gears a little bit. Share with us, what is your all-time favorite leadership book and why?
Okay, well, I would have to say it's a book by Warren Bennis, and it's called Geeks and Geezers.
Okay.
And so what Warren did is it's based on research. He interviewed leading entrepreneurs and successful leaders in the corporate industry. And so the geeks, of course, are the IT, the technology industries, the new kids on the block. And then he also interviewed, the well-established corporate, the blues, in that arena. And what he found is that successful leaders have all had an experience that has changed their life, and it's been applied to leadership. And so he calls it the crucible experience. And so they may have had more than one. But something, I talked earlier about learning from your failures.
Yes.
So individuals have had personal experiences or professional experiences, family experiences that have really helped them get back to their core values. And it's those values then that have driven them to success.
Okay, so if you were to wave a magic wand and there would be maybe just one thing that you would be able to say, right now, this is changing, this is what I want to happen for the nursing profession, what would that be, Ann?
It would be that we recognize the knowledge requirements that nursing is a STEM discipline, and that we are sure that our entry-level nursing workforce is educated to the highest possible degree so that they have the knowledge that they need, the critical thinking skills, and the management skills that they need to navigate the complexity of care in our systems today. a nurse is not a nurse is not a nurse.
Mm-hmm.
And if we're really going to tackle the issues of healthcare in this country, we need to make sure we have smart people at the bedside,
Yes.
well prepared, who know how to acquire knowledge at the point of care, at the tip of their fingers, and make adjustments in their practice patterns that are going to have the best possible outcomes for our patients.
That is fabulous. Let's go get that magic wand.
Let's do
right?
it. You got it here?